Doctors diagnose hypothyroidism based on symptoms like fatigue, unwanted weight gain, dry skin and hair, depression, and cold intolerance. In addition, doctors include a complete blood test panel measuring your thyroid levels to evaluate whether you have a thyroid condition. Interestingly, some experts believe that measuring a woman's basal body temperature can provide valuable information about thyroid function. Unusually high or low temperatures may indicate problems with your thyroid. Let's take a look at this important question. What does a low basal body temperature have to do with hypothyroidism? First, what is basal body temperature? Also known as BBT, it's the body's lowest resting temperature, typically measured first thing in the morning. The basal body temperature indicates how well your body's metabolism is running. What's a normal BBT? A temperature reading of 96 to 98 degrees Fahrenheit is typical before ovulation in women. After ovulation, a woman's basal temperature can rise to 97 to 99 degrees Fahrenheit. Here's an interesting point. There is no average basal body temperature for men, as it's a term used to describe the temperature of a woman's body at rest. Women often use basal body temperature monitoring for fertility tracking, to determine ovulation, and identify the best times to conceive to achieve pregnancy. Thyroxine, known as T4, is a key thyroid hormone. T4 affects your body's temperature. Too much T4 raises basal temperature, while too little can lower it. When a woman's BBT is consistently low, it may indicate a sluggish metabolism linked to hypothyroidism. BBT alone is not enough to diagnose a thyroid condition. But some experts believe BBT can complement blood tests in evaluating thyroid function. To measure your basal body temperature, you'll need a special basal temperature thermometer that shows 2 decimal places, not just one. You can purchase one of these thermometers at any pharmacy or drugstore or even order one online. To measure your BBT, first, keep your basal thermometer at your bedside table and at arm's reach to limit your physical movement, which can alter the temperature reading. Next, take it immediately upon waking, while you're still in bed, while minimizing movement. You'll want to take your temperature at the same time each morning. Track your readings daily and note any influencing factors. Factors that could influence your body temperature include alcohol the night before, stress, traveling between different time zones, and having a cold or flu. If your basal body temperature is consistently low, it might indicate hypothyroidism. The first step is to have a complete thyroid test panel, including TSH, free T4, free T3, and thyroid peroxidase antibodies. If you're diagnosed with hypothyroidism, the next step is treatment with thyroid hormone replacement medication. Once you're optimized on thyroid treatment, your metabolic rate should improve and naturally raise your basal temperature. Tracking your basal body temperature is just one piece of the puzzle. When you combine it with comprehensive thyroid testing, like Paloma Health's complete thyroid blood test, and a consultation with a knowledgeable care provider, you'll have a clearer picture of your health. This video has been brought to you by Paloma Health, the nation's leading medical practice dedicated to hypothyroidism care. Learn more at www.palomahealth.com.